Let's bring in Chief Innovation Officer, Boston Children's Hospital, and ABC News medical contributor, Dr. John Bronstein. For more on this, Dr. Brownstein, thanks for being here. What's your reaction to the lockdown in Shanghai right now? What does it mean for other countries watching this as well?
Right. Well, we have to remember that China has really attempted the zero COVID strategy, which is trying to stamp out infections, prevent spread in communities. And this is really in contrast to the rest of the world that's moving on, easing restrictions, attempting to live with the virus. And the reason that they've attempted these extreme approaches is that, they have many parts of this population that are unvaccinated and actually unboosted. They use this one particular vaccine, Sinovac, that really requires 3 shots. So they need to do more to control this virus, but this is an extreme approach. And lockdowns really tend to have significant impacts like we've seen with families here. We will not see this in the US. We have learned to control this virus with vaccines, reducing mobility, masking, good ventilation. So we know what it takes. Unfortunately, China is a few steps behind when it comes to controlling COVID, and they have to do these extreme approaches, which clearly are having significant impacts.
And an FDA panel is scheduled to meet today to discuss the future of COVID boosters. What do you expect to come out of that meeting?
I think it's going to be very interesting because they're going to be talking about this approach to getting additional vaccines to people. Now, what we have to remember is that the current version of the vaccine is based on that old variant that first emerged in China, and we're still using that to boost the population. And of course, we're seeing this early data that even a second booster doesn't provide the same protection that you'd want to see because, again, Omicron is evading those vaccines when it comes to infection. The vaccines are still doing an incredible job around severe illness and death. But I think what we have to do is start focusing on matching the vaccine to the variant that's emerging, and that requires modeling, forecasting, and really an approach that's very similar to what we do with the flu epidemics, where we try to do the best guess possible to the vaccine that ultimately has the best match to what's circulating in the population.
Now, the committee is also set to talk about whether the vaccines need to be updated to address specific variants. And they just discovered a new variant in the United Kingdom. So what do we know, one, about this new variant and these potential vaccine updates?
Right. So it's a big question right now because, of course, we're seeing a new variant that is still in the Omicron class. And I really want to urge people not to get too nervous. It's actually a hybrid of BA1 and BA2. And I know we're so fatigued with seeing new names of variants. This is XE. We've actually had XA, XB, XC. I think you remember we talked about the Deltacron, which was Delta plus Omicron. Now, these are 2 Omicrons together. Now, it may be slightly more transmissible, but so far it's not a public health concern. But it does tell us the fact that this virus continues to evolve, that we will see new variants emerge. And what's on the FDA's plate right now is how do we adapt this vaccine? How do we make sure that the vaccine is keeping up with the evolution of the virus? And that's really what they're going to be talking about today as part of that FDA panel.
Now, Congress is trying to pass a $10 billion COVID relief package right now. What would that look like, and what would that money go toward?
That package was actually significantly larger. It was $15 billion. What we're seeing in the $10 billion is efforts around therapeutics, testing, vaccination distribution, real efforts around surveillance and forecasting, money that goes to local public health, state public health that bear the brunt of this pandemic. So we really need that infrastructure in place, efforts around vaccine manufacturing and therapeutics. What it's missing is $5 billion towards global vaccination efforts and the funding that would go to USAID to really immunize the globe. And, as we just discussed, variants are continually emerging. And so if we don't have an effort to vaccinate the globe, we will continue to see new variants and we will not be out of this pandemic. So that is a concern, that this package really isn't addressing the global concern of this pandemic. And I really hope that ultimately we will see additional funding to handle, the fact that the pandemic is global. It is not just a US problem.
And Dr. Brownstein, what's the latest on treatments? Because while there's a lot going on exploring vaccinations, there's also a separate set of research looking at best ways to treat COVID and live with it, right?
Right, of course. And, I think we don't talk enough about therapeutics, and there's been incredible research to show that, the antivirals, Paxlovid, as we've spoken about several times, really is incredibly effective at reducing your risk of severe illness. And we right now still have shortages. There's very small numbers of doses out in the community, which means that it's very restricted to who can get access to it. But as supply increases, we're going to see more delivery of these therapeutics. And this is one new way that we're going to live with this virus, because it's not just going to be about vaccines. It's going to be about making sure we're getting therapies to people to protect them against the severe consequences of this virus.
All right. Dr. John Bronstein, always great to have you. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.